You're watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Today's topic, what you need to know if you're considering any type of cosmetic surgery. With us, we have Dr. Boris Volshteyn. Dr. Volshteyn, welcome to the program.
Thank you very much.
Now, before we get into today's topic, tell me a little bit about your center.
We're located in Reno, Nevada. Beautiful area, beautiful mountains, very nice people. And we have a new facility right there in the south portion of Reno. The name of the practice is CR Plastic Surgery. Over 3,000 square feet with operating room suites, private rooms.
You have one operating room?
We have operating room, one
okay,
operating room
good,
suite,
good.
yes. Very nice, very private.
So you do everything there?
Pretty much, pretty much. We use local hospitals also. They have great facilities, but we prefer to utilize our facility for privacy reasons and comfort of the patient.
Now, your medical training, your background, let's talk about that.
I was trained initially in Russia. Then I came to the United States a few years ago, and I trained in the University of Missouri. I received a medical degree there. Before that, I received the master's degree in physiology in Chicago.
A master's degree?
Master's degree.
Is that rare? I mean, I don't hear that, medical doctor getting a master's degree.
It's not very common. I have always had interest in
physiology.
Physiology. Human anatomy, physiology, art, it was a good combination. It really allows to look at things slightly in a different fashion, more from a combination of anatomical beauty and physiological performance.
All right, now you've developed a big name in Reno as the guy that does the quick lift, the mini lift.
I don't know about the big name, but we do a lot of cosmetic surgery.
I mean, you're very busy there. I mean,
we're
you're
busy.
By far, probably one of the busiest guys.
We're very, very busy. We're blessed with having a lot of patient following, and we specialize right now on mini lifts, mini facelifts.
Now, one of the things you said to me, you said that this is a direct quote, that you seem to attract somebody that wants a natural-looking face.
We do.
Not
majority of
pulled.
people, yeah, majority of people don't come in and say, "Hi, I want a facelift." They come in and say, "You know what? I really don't like this. If you can get rid of this, I'll be happy. All I want is just a little bit of that, like that. That's all I want. I don't want to look unnatural. I don't want to look pulled. I don't want to look like one of the Hollywood celebrities. I just want a little better. If you can do a little better, I'm happy."
What are the age ranges of patients that are doing this?
It varies from mid to early to mid 40s to late 60s. The oldest person we did a quick lift on was 83.
Wow.
She has a 75-year-old boyfriend. He doesn't know that she's 75, so she's 8 years older.
Okay.
And she wants to keep it that way, and so far it's working out very nicely.
So what is help me understand the difference between a traditional facelift and what you're doing with the mini lift? Yeah.
Well, on the spectrum of things, people can start with doing injections. That's for the people who don't want to have anything surgical done. Then we can do lasers. Then from Russia, as a matter of fact, the new technique came out of thread lift, and it was very popular for a few years. We don't do it anymore. We found that it lasts for maybe 3 to 6 months. It doesn't quite work. What it is we put threads from the ear all through the cheeks with soft tissues. Little barbs come out from the thread, and it's supposed to hold the cheek. It works better in the book than it works in people.
All right.
And when people are not happy, we're not happy. So after we've learned that it doesn't work, we don't do it anymore. On the other spectrum, there is a full facelift where we lift up the skin, we lift up the muscle underneath, tighten everything in individual fashion, and but then we have to lift all the muscle tissues from the nerves, risking damaging the nerves. So
you do those too, though?
I do those too.
Okay.
For people that need it.
The older patient?
Not necessarily. Depends on how much of improvement the people want and what specifically, what specific issues we're trying to address. Majority of people don't come in for that. They don't want the full facelift. Unfortunately, the association between
there's a lot of negativity, I guess.
Absolutely. People think that Joan Rivers is a facelift, Kenny Rogers is a facelift, but if they don't, and usually people come in and say, you know, I don't want a facelift because I see people in the store, I can see the facelift patient a mile away.
I feel like I could spot, I told you this on the phone, I could spot a facelift 20 yards away. You said
That's
not
true.
mine.
Well,
you said not mine.
That's true. Because a majority of people I can spot it also, and I wouldn't want to be associated with that kind of work.
Okay.
So you can spot a facelift a mile away. That's true. The one that's overpulled, tight, old-fashioned, so to speak, facelift. Majority of facelifts or mini lifts that we do, you'll be talking to them for an hour. Like majority of our before and after patients or pre-op and post-op patients do, and they have no idea they just talked to a quick lift patient.
Is that right?
Or
So,
a mini facelift patient.
So these mini lifts, I mean, how many years can you take off? Okay, so somebody's 55, 60.
It's very difficult.
What do
to
they
talk
say?
about
What do their
the
spouses
years.
say? You tell me that. What do they say?
Well, it's very difficult to talk about the age-specific numbers because for some people it's 5, 6 years. If you're in your late 30s and you have a couple of kids and you're very athletic, remarkably so, athletic people commonly get this kind of exhausted look on their face, even though otherwise they're physically fit. So if you just tighten up the skin a little bit, bring that younger skin, bring the cheeks back up, you start looking literally 5 to 7 years younger, and that's enough for somebody who's in their early 40s.
Okay.
Once you go to the mid 50s, you can produce more dramatic results because you have more extra skin. You lift things up, and at the end you're looking maybe 10, 12 years younger.
So this is not gimmicky. I mean, this is a real
This
procedure
is a real,
with
it's a real procedure, correct.
Because one of the other ways you call it is a 50-minute lift.
Well, 50-minute
Are we
lift,
still talking about the same thing? A
We're
mini
kind of
lift?
talking about the same thing. It's still a mini lift. Anything short of a traditional facelift is a mini lift. And again, there are over 200 techniques of it. We found the techniques that work reliably, stably. They produce reproducible, long-lasting results. Patients are extremely happy, and we're very careful about tracking the patient satisfaction. Our satisfaction rate way over 90%.
And the downtime, I mean, you get big results with low downtime.
Correct. Well,
I mean, how soon can they go back? A month?
No, way less than that. I mean, a lot of people go back to work doing their regular stuff in about a week to week and a half.
Okay.
On the shorter end, 5 to 7 days. It's very much
Really?
individualized.
5 or 7 days? They
Absolutely.
And you say that even their friends don't quite know what they did.
No, and that's the best thing we tell the people.
Is that right?
It's absolutely true. We tell the patients right away. If you expect your friends to meet you and say, hey, nice facelift, it's not going to happen.
Okay.
They're not be able to pick it up. They're going to say, well, you lost weight, you look skinnier, you look more rested, oh, you really needed a vacation at the lake.
Yeah.
Majority of our patients don't really openly talk about it with their friends
So
right
in your
away.
opinion, when should somebody do something about it? I mean, look
Whenever
at a
you
mini
notice
lift.
it, whenever you start avoiding the mirrors, whenever you start wearing turtlenecks, whenever people telling you that
Okay.
it's an indicator. Whenever people telling you, listen, you look angry, you need a vacation, you look tired. And a lot of people won't
Do they
tell
tell you that? People say, hey, you look tired?
That's what they come in and say, you know, I really don't want to look as tired as I look. And I have energy. I'm exercising, I'm active, I have active social life, I have active career. And people just look at me and ask me, are you tired? And I realize that there's something I cannot do anything about with exercise, with diet. So that's why I'm here. And all I want is just a little tightening right here.
Okay, now you have dramatic photos. None of those are touched up.
They're not touched up, and really they're not dramatic. This is the average result. And I'm not saying average from a standpoint of the quality of work.
Because we're going to have to put results not typical legally on this show.
Correct.
But
correct.
are these results typical?
They're usual results. They're usual results. They're not perfect. We're not shooting for the drum-tight looking appearance. We're trying to get rested, more relaxed, more defined facial features that give you that youthful appearance without overpulling, tightening, and giving a kind of a windblown look.
Okay, in your hand. Somebody goes in your office. How do you look at the aging face?
It's more than just looking at the aging face. You have to establish the understanding with the patient. I need to understand that whatever your expectations are, whatever your understanding of beauty is, fits with what I understand I can do.
Okay.
If we meet, then we can start talking about your face.
Do they know what they want? I mean, they come in and they specifically say, hey,
Some people do.
my jowls, my crow's feet.
Some people do, some people don't. And for some of them, I'm a good candidate. If you want to look like you've been pulled, you're a wrong person in my office, and we'll tell you that.
Don't go to you.
Don't go to me.
Okay.
If you want to.
So when you look at the face, you examine the face. I mean, are you looking at the eyes first?
I look at everything. I just have a system where I look from top to bottom. I look
Okay.
at the brows, I look at the forehead. Usually what happens is the brows drop, the crow feet appear, there's a little heaviness on the upper and lower eyelids, the bags under the eyes, the cheek starts going down, the folds between the nose and the mouth start becoming deeper, the mouth corners up so it has wrinkles right here, and some people actually have irritation right here that causes the saliva to drop. Okay. And then the neck relaxes, causes a lot of wrinkles, and that whole appearance creates the older, more tired
are you just
look.
repositioning tissues up again?
We'll lift them up. And we have to lift them up in an individual fashion. Somebody has just a problem with the neck, so let's address the neck. For somebody, we have to lift up the neck, the jowls, and the cheeks, so that's what they get. And for other people, we have to lift the whole side of the face. lift up the brows, clean up the upper lower eyelids.
Could a critic say, could the argument be from another surgeon saying, the problem with the mini lift, it doesn't last. The results don't last very long.
It's not quite correct. I think you're confusing it with a thread lift.
Thread lift. Okay, so this is nothing like a thread lift.
This is not a thread lift. The only commonality is that both use sutures. One puts the sutures underneath the skin in a fatty layer, and it doesn't hold. We know that.
Interesting.
In order to get a durable and long-lasting result, we have to lift deep tissues up, the muscle layer, and that's what we do with the sutures.
So the muscles are actually being lifted in addition to the skin?
Well, actually, that's a primary moving target. The skin just follows, and that's why we cannot physically create a pooled look, because muscle will limit the amount of advancement that we will get. The sutures that we use, they're permanent. They're used for hernia surgery, heart surgery, tummy tuck surgery. They're designed to stay in.